Is it safe to relax these lockdowns now?
You know, if you do it gradually, George, without like turning a light switch on and off, remember, we had that conversation months and months ago when we were trying to open up America again for the economic reasons. You want to do it gradually and safely as opposed to just turning it on and off right away. There's still going to be the important need to wear masks. I think we still need to do that. You want to avoid congregate settings, but you can gradually get to the situation where you might open up restaurants with limited seating and things like that. But it's got to be done prudently and gradually.
And when you say need for masks, you mean for quite some time, into the foreseeable future, a year, 2 years, 3 years?
I'm not so sure it's measured in years, George, but I think until we get the level of virus to such a low level in the community, and I had said a projection, and it's only a projection, that hopefully by the time we get all the people vaccinated, let's say 70 to 85% of the people vaccinated, the level of virus in the community could be so low that you could start pulling back a bit on what are stringent public health measures. You don't want to do it all at once, but I think we're going to be wearing masks for several months into the future.
He's actually telling you that we're going to be wearing masks until at least the end of this year and probably this time next year. And I would wager they're not going to really, the mask shamers, the people, why aren't you wearing 3 masks? Where are your 3 masks? Those people are not going to calm down until next June. Not this June, next June. So if you're in a blue state, I know a lot of you in red states, you're like, stinks for you, Buck. I know. But if you're in a red state, you'll be okay. If you're in a blue state, there are going to be people. Remember, because it's all about whether they think the mob would be on their side. That's really what it comes down to. Are you in a part of the country where someone mask shaming you, you know, people that are standing around or that are watching this would say, it's just one person. They're probably fine. You're not near them. Stop being crazy. Leave them alone. Or would they all run up to you? Why aren't you wearing a mask? Where is your mask? Because I can tell you here in New York City, that's what it would be right away. How dare you not wear your mask? Oh, my gosh. All the time. All the time. I can't tell you how many people I see. The mask is down, their nose is exposed, and I don't care. But I'm just saying, it's the whole thing is so absurd. It on its face. Now it's double masking. You know, I put a video on TikTok. I got suspended from TikTok because I put a video up arguing that we shouldn't have to mask and social distance after any individual should not have to do that after they're vaccinated. Because we at that point, you've hit an acceptable risk to other people. If I get vaccinated and I get sick and I die, that's on me. I want to live my life. If the rest of society gets vaccinated and then 1 or 2 people out of 10,000 or 50,000 give the virus to somebody else, eventually there may be one person who dies because of COVID that wouldn't have otherwise, but is the speed limit 10 miles an hour or not? I know they hate this argument, but that's because it's true. People go, oh, look at seatbelts. Masks are like seatbelts. Really? You got to wear a seatbelt when you're going for a walk alone in the woods? Got to wear a seatbelt every time you're outside your home? Got to wear a seatbelt? I mean, no, it's not the same. One is super annoying and tyrannical and dehumanizing, and the other is a minor inconvenience for the duration of time that you are in a vehicle. And, yeah, quite honestly, the government probably shouldn't be able to make you wear a seatbelt, if we're really being honest. They always say it's because you could, I've heard the argument that you could become a projectile and hit somebody else, right? They make it about someone else so that they can control you, which has been the nightmare of COVID all along. You know, if it were just about you taking individual risks, that would be harder for them. But they say, oh, but you're putting all these other people at risk, so then they can control you. David Leonhardt over at the New York Times wrote on COVID absolutism. And I'm starting to see this. Oh, the New York Times will publish something about how this has gone too far. The people who are saying, listen to the experts, obey the science, they are now officially emotionally unhinged about this for anyone who's paying attention. There's a balance here. I've never said, oh, there's nothing we should do at all. There's no reason for worry. You know, none of that stuff. But they always pretend. They create this massive straw man of, yeah, whatever, just live your life, go out there, go to bars, breathe in people's faces. or you can't leave your home, you can't be outside, you can't do anything until they say so. And they'll say so not in a couple of days, not in a couple of weeks. Now we're going on a year. I'm just wondering, you start to see this. With the government, where does this ability to protect the public from the possibility of disease stop? If the government wanted to indefinitely quarantine a whole state, could they do that? Would that be okay? Would you be all right with the federal government saying, oh, sorry, we've had a lot of cases. Of course, it would be Florida they would pick on right now. A lot of cases in Florida, so no one's allowed to leave the state of Florida. And they put, troops on the border and shut down all the airports. No one can leave Florida. Public health, public safety. I think there's a lot. I know this is just a thought experiment, but there's a lot of people in America right now who, if Fauci said that's what we need, they would do it. They'd go along with it. I would be at the point where I would have to say it is time to take up arms. We cannot allow that. That is the kind of tyranny that was warned about in the Constitution. That is the kind of tyranny that was the basis for the Second Amendment, right? You can't go anywhere. You didn't do anything wrong because the public health authorities say so. For how long? How long can they lock you in your home? I mean, is this communist China? You started to see, I understand, we're not at that point. I know that we have not yet gotten there, but we've been moving in that direction. And there's been far too little willingness to have a discussion about what are the red lines here. Finally, it seems, the New York Times has published something where they're saying, you know what? This has gone too far. And they liken it to the overreaction to the AIDS crisis, which is interesting on many levels, but one of them is that Dr. Fauci was one of the people who was just stunningly, horrifically wrong about who was really at risk from HIV and what public health measures would help contain that virus. You can go back and see this is all public record, because that's how long Fauci is running the CDC or NIAH or whatever. That's how long Fauci's been in public health. He's been there since the 80s. Think about this. This guy's been in this game a very long time. Terribly wrong on HIV. But let me go to this piece in the New York Times. In a public health emergency, absolutism is a very tempting response. People should cease all behavior that creates additional risk. That instinct led to calls for gay men to stop having sex during the AIDS crisis. It has also spurred campaigns for teen abstinence, to reduce STDs, and to fight obesity. People have been drawn to fads like the elimination of trans fats. These days, there is a new absolutist health fad, the discouragement or even prohibition of any behavior that seems to increase the risk of coronavirus infection, even minutely. People continue to scream at joggers, walkers, and cyclists who are not wearing masks. The University of California, Berkeley this week banned outdoor exercise, masked or not, saying the risk is real. The University of Massachusetts Amherst has banned outdoor walks. It encouraged students to get exercise by accessing food and participating in twice-weekly COVID testing. A related trend is hygiene theater. As Derek Thompson of The Atlantic described it, the New York City subway system closes every night, for example, so that workers can perform a deep cleaning. There are two big questions to ask about these actions. How much are they doing to reduce the spread of the virus, and do they have any downside? The answer to the first question, according to many experts, is they seem to do little good. Prohibiting outdoor activity is unlikely to reduce the spread of the virus, nor is urging people always to wear a mask outdoors, end quote. Who has been saying this? I don't mean to do this I told you so thing, but I've been telling you this all along, and I know you listen to me because you agree with me because you're smart and you understand what's going on. So we've been saying this for how many months? You and I. We've been telling anybody who will listen to this for how long? Outdoor masking is crazy. There is no data to support this. There's no reason to believe people need to do this unless you are up close to people so that your breath is actively hitting them in the face for 10 or 15 minutes at a time. So, yes, should you go shoulder to shoulder 100 people in a protest? Probably not. But walking around on the street, I want to bang the table. There is no science or data to support outdoor masking. Why won't Fauci say that? Why won't Fauci say it? Because he's a little coward. That's why. Because he wants the establishment. He wants the Democrats to like him. He wants to be the man of science. If they were reasonable, I would give greater leeway for them to be wrong on things where they're wrong based in good faith. Do I think, for example, that that masking is an exaggerated defense against this virus because the left has politicized this? I think it's exaggerated, yes. I think it can work in certain circumstances, in certain times. If you wear it 100% of the time correctly, a fresh mask, can it help? Somewhat. Not a lot. Go look at the data on measles, aerosolized virus. Go look at the data on measles, and you'll see. You go into a room and you've got a cloth mask on, you're susceptible. You're still getting measles, basically. If you're there for more than 20 minutes. So it's not 100%. It's not even close to 100%. And no one knows what the real percentage is. But just based on the observations we have of places where there's widespread masking, it's clearly not as effective as I said, which is why they're demanding double masks now. And I told you they would 6 months ago, 9 months ago. They're going to claim double masking needs to happen. Why would they say if a mask is so effective, why is it double masked now? Because they have to go to the next thing. The logic of the absolutism here is, we just didn't do it enough. It's like the logic of supporting communism. Oh, my God, it's ruined society. Oh, this wasn't the right kind of communism. Right? This wasn't the right kind of Fauciism we've suffered through in this country. That's why we didn't stop the virus in its tracks. But, if they were willing to be fair and say things like, no, there is no reason to mask outdoors. There was never any reason to shut down gyms. That was also crazy. There was never enough of a risk in restaurants where people are seated at different tables with decent ventilation to shut down all these restaurants. New York City thought that 1%, this is the most restaurants, the densest city in the country. They thought that about 1.6% of COVID cases were coming from restaurants. 1.6%? And you're shutting down, can we focus on the other 98.4%? Oh, no, because that's harder. That's harder to get compliance over. You see, they're wrong. They've been wrong a lot. And some people are starting to notice that if you don't tell the crazies to stop being crazy, it keeps going. It keeps going. Get exercise when you leave your room for your twice-weekly COVID test, they say at the University of Massachusetts. That place is now effectively an insane asylum. And now I also have to think about how much real and serious and honest mental health destruction is going on across the country because of this. And it almost becomes a self-fulfilling prophecy. Make people terrified, lonely, and depressed, and tell them the only way things will get better is if they do the things that are making them more terrified, lonely, and depressed. That is our COVID policy in a nutshell. Hey, Team Buck, thank you so much for watching The First on YouTube. If you like this video, please click that little thumbs up button so then it will log as liked. And also, if you want to see more great content from The First, please click subscribe.